Good evening, everyone. Sorry for the delay in our start. I've been concerned about our second and third speaker. I think they got caught in the accident on 380 just outside of Greenville, because that's the direction they were coming down Highway 69. But they're here, so Julie feels better. So how many of you all have attended our seminars before? Good, good. A lot of repeaters. Welcome back. This is our final seminar for 2021. We had some awesome speakers, and I appreciate each of you that have attended. I want to remind everybody about our respite care program. You've seen the flyers, and our respite care program consists of 3 different free services. One is respite care within your home, provided by Family First Health. They will provide a professional to come in and screen your loved one, and then you all will discuss hours and days and things like that you would like to receive respite care. Also, we have housekeeping that is put on. They British Bubbles. Is it British Bubbles and Beyond? I think there's what they're called now. It's a daughter and mother team. They actually clean my home, and so they go in and clean the homes of our caregivers. Yes. And lastly, lawn care by Newman Lawn Care. So we know everyone needs their, I wish I could qualify for free lawn care. Oh my gosh, the rain won't stop, so the grass doesn't stop, right? So take advantage of this, okay? It's getting hot outside. You caregivers don't need to be outside mowing. You know, let's set up a time. We have applications over here on the table out front where you signed in, so you can sign up for 1, 2, or 3 services, okay? So make sure you grab those before you leave, and you can give those to Melva. So our first speakers are from the fire department and police department here in Greenville. And I'm really excited to hear what they have to talk about, because it's in regards to... Huh? Oh, sorry. Thank you, friendly. Put your phones off, please. He just gave instructions. I thought he was telling me I had a call. Yes, please mute your phones. Okay, the first is Sylvia Peace. She's from the Fire Life Safety Education Coordinator for the Greenville Fire Rescue. She's been there for 8 years. She's been with the city for 17. She coordinates fire and injury prevention programs for all ages, but she has a special place in her heart for the elderly. She currently, Older adults, sorry.
Nobody in here elderly?
Okay, older adults. I should learn how to say that. Currently, she's serving on the Fire Life Safety Education Textbook Validation Committee for International Fire Service Training Association, FSTA. And serves on the 2020 Educational Messages Advisory Committee on the National Fire Protection Association. She's busy. We're very lucky that she could squeeze us in. Also with her is James Hamilton with the Greenville PD. I do not have a bio on him, but I can tell you one thing. The one thing Friendly says, that right there is a good man. So you all know him. So without further ado, they're going to give you a presentation that I think is going to be very important and that you're all going to enjoy. Thank you. They're right here.
Do I slip this on?
Yeah.
Or over my ear?
Yeah, over here. And then you clip it on your pants, your pocket or something.
Get plugged in up here. Maybe I won't. My pocket, but that. Oops, we're good? Uh-oh, hang on.
Maybe go from the other ear.
Let me do it on this side. Good now? Oh, I can hear me. Woohoo! All right. Okay, well, thank you guys for coming out. It's a pleasure to be here. This is my first program post-COVID, coming back from the fire department. We got locked down pretty good on doing programs. So, as you can imagine, we try not to get our firefighters sick so they can still continue to help you guys. So, so at any rate, I am happy to be here, and what I'm going to talk to you guys about is a new app or database that we have that's accessible to our firefighters. James and I have similar databases, but they're very different in what they can do. But they're both very essential to helping the first responders provide you guys care and in the event that you guys need an emergency. So I'm going to go through these slides real quick. This is kind of my long version of our PowerPoint on this, but there's a couple things I want to show you. So Community Connect is the name of our, it's the name of our app that our guys use that they get their incident calls on. So when they get toned out for an emergency, they are able to see this on their iPhone or smartphones or on their laptops that are in the fire engine. So they're able to get all kinds of information. And so what it's used for is for pre-plans for businesses. So if we have a business that has lots of chemicals in it, then this app will have those list of chemicals so our guys will know what's there before they get there and will know how to plan for their response to that incident. So the same thing goes for Community Connect. It's a pre-plan for your house, but it's something that you guys fill out because you guys know better what's at your house. Where our guys get to go into businesses and do their pre-planned surveys, we can't come into your home and do that. So you guys know better what your house is, and we spend time planning on vacations, retirement, what we're going to get at the grocery store, what we're eating for supper. But how many of us plan for emergencies? Nobody really, right? I mean, not a whole lot. You might plan for a tornado and have your go bag, but do you plan for what's going to happen if I have to call 911 and the fire department or police department, whoever has to come to my house? We don't usually do that. So that's what this app is for. Well, I'll learn how to use a clicker. Okay, here we go. So firefighters do pre-plans to protect businesses, help them stay open so that they can continue to employ their residents and continue to survive in the business world. Well, we do the same thing with our residents. We want to have the same thing. We want you guys to stay home, so stay safe in your home. Some of the things they look for in a business is like hazardous materials, water connections, exits, and things like that. And this is what it would look like if we did it. This is a business pre-plan, so that's what it would look like. That's probably like a rehab facility, nursing home type place. And so the guys go in and put all this information in, and that tells them where to go. So Community Connect, gosh, can't talk. Community Connect is a pre-plan for your home. It tells us things like how many people are in your house, where the bedrooms are, if you have health issues that we need to be aware of, if you have pets, if you have a fire, so that if you're not home, we can go in and look for your pets, where the cutoffs are, the utility cutoffs are, because if you have a fire, we need to know to be able to cut off electric or gas or anything like that. So you guys are able to go in and put this information so that we'll know that as we get to, when we get to your house. So this is one of the slides that I wanted to show you is that, so when we come to your house, if there's a fire, we typically do a search. The guys call it a right-hand search or a left-hand search. They go in, they're on their hands and knees, and they're following the wall of your house. So if you imagine them coming in the front door, it might look like this. They come in, they come to the front porch, they follow the right-hand wall, they turn into that first bedroom, keep going until they get that bedroom, they go to the next one, and if you can see, this is a big house, so it's going to take them a while to get through the whole house. But if you put your information in Community Connect and you put where your bedrooms are, this is how fast they could come in and search your house. They know right where the bedrooms are, there's no guessing, and that saves so much time because a house can be fully involved in minutes. So that's one of the biggest reasons we want people to be able to fill this out or create an account, is because those seconds count when it comes to fires and things like that. So other things that you can put in there are if you have health issues, if you have, maybe you have cardiac issues or there's oxygen in use in your home. That's important things to know if we have a fire, but it also is important so that if our guys come to your house and say, for instance, it's 3 o'clock in the morning, you pass out, your spouse had to call 911, but they're in a panic because it's the middle of the night and they can't tell all your information. They can have this, they can see this in the app. They'll know what's there and what possible things to look for, which helps speed up the kind of care you're going to get. Plus, they're able to tell AMR, the ambulance service, hey, this might be one of the things you need to look for, and that all makes for a better outcome for our residents, which is what we want. James has a file of life. It's kind of the same thing. His is on, theirs will be on the refrigerator, and he'll tell you more about that. But it's kind of the same deal, but this one is also another one you can fill out. Let's see here. All right, so another thing that we have, so like if you have family members that are with Alzheimer's, dementia, or autism, if they have a tendency to wander, you can also upload their information. You can upload a picture, similar to what James is, but also different. He has some other things that goes along with that we can't do because we're not the police side. So he'll tell you guys about that. But that's one of our biggest things, because I don't know if you know about autism, kids that are on the autism spectrum, like 90% of the kids who are 14 and under that die because or when they've wandered off is because they've drowned. And so that gives us information to make sure we're going to pools, ponds, tanks, or whatever that's closest to their house because they're attracted to water. So things like that we can know that help speed up our responses is what we're looking for. Oh, didn't push hard enough. Here we go. Okay. Mobility issues. If you have a fire and you aren't able to get out, you might have to, or if you're on a cane or if you're using a walker. My husband's currently using a walker right now. He's had some health issues. So we've talked about how are we going to get you out of the house if something happens. And he, of course, he's a retired firefighter, so he's like, oh, I'll get out of the house. I'm like, okay, but really, how are we going to get you out of the house, right? So, but that's things that you need to think about, and that's something that we can do also helping you with your fire escape plans. But if you have mobility issues, you can put that in the system for that person and put, they're in this bedroom, or the person that's in this bedroom is bedbound or is on a walker or cane or wheelchair or whatever, and then that helps our guys also in their response and in trying to come in and help. All right. Then, of course, like I said, you can tell us where your cutoffs are. If you have pets, who doesn't want to have their pet saved, right? So we have a place in there where you can put pets. You can put a picture of your pet, the location of their crate. Like if they're crate trained and they sleep in their crate, like in the kitchen, then our guys will know, hey, we need to go in the kitchen and check and find, little Spot or Fluffy or whatever. Now, my dogs sleep in the bed, so you just have to tell them, go find them in the big back bedroom. But this is one of those things that, our guys try to save all life. So, and of course, pets fall into that. We got a lot of guys that like pups. So if you have a tornado shelter or storm shelter or safe room in your house, that's another thing you can put down. So you can see the house on the right-hand side, or the picture on the right-hand side. We wouldn't know where the streets are or what your address is or where your house is because there's nothing to identify it. So you can actually put GPS coordinates in, and we can come in and find you after the fact. Swimming pools, that's another thing. And then, especially during the pandemic, we had a lot of kids home alone that we need to know about. So this is what the information looks like when you go in to create your account. You would have to have an email address, or you can call me at the fire station and I can help create an account for you. The reasoning behind having an email account is so that you have a way, or the system has a way to send you a reminder on an annual basis and say, hey, is your information still up to date? Because something could have changed. You might be mobile right now, but later on you might be like my husband. Now he's on a walker. So there's things like that you want to keep your information as fresh as possible. On this one sheet that I gave you is like a little worksheet. So if you can't create an account on your own through the internet, you can fill this information out and we can make an appointment, and I can either come to your house and we can do it, or you can come up to admin and we'll create you an account up there. The other good thing about the email is that if you have maybe a son or a daughter that kind of takes care of your information for you, or that you just want them to know, you can put them down as a contact. But you can also, they can be the one that gets the email to make sure your information is updated. So you don't necessarily have to have the email if you don't have an email account, but you can get your son and daughters, and then they could create an account for you. So that's another good way that you can use it. Oh, I got quiet. So Community Connect's free. It's bank level secure. It's only available to the first responders. You can use it on any kind of smartphone, laptop, tablet, and your family members can register for you if you guys don't have internet access. All right. So, kind of talked about how you sign up. Like I said, contact me, or there's a little QR code if anybody knows how to use those, where you can scan with your smartphone. This little code back here, it'll pull up on your device, and it'll take you to the account, and you can sign up through there. So, like I said, it's a lot of good information, but it's a different but same as what he's doing. We're using it to provide a better outcome for you if you have an emergency as far as EMS or fire or something like that. James has a whole different approach to it. Still good, every bit as good, and we encourage you to sign up for both of them. So I'm going to turn it over to James. Or does anybody have any questions? Yes, sir.
Yeah. Is Campbell on it?
Oh, okay. I'm glad you brought that up. So currently, this is only for City of Greenville residents, and that's just because the way this app works is on the boundaries of the city. And this is a paid subscription that the fire department purchased, so right now it's only for Greenville residents. But keep an eye out, because if there's a way we can do it, we're going to try to get it, see if we can't get cooperation, get it county-wide, because it would be handy for all residents. So, yes, very much so. So, and then also, that's another thing, you can approach your volunteer fire department and see if maybe they can do something to get it for them. So. It would help all of us. It's a great tool to have. Any other questions? Yes, ma'am. Anybody can do that? As long as they live inside the city limits. And it doesn't, you don't have to have any kind of special need or anything. This is for any resident to register, just so that we have information about your home. So you can be healthy as an ox and still have an account. So don't let that hold you back. But it's really great if people have special needs or health issues or things like that. So, and I'll be around, so if you guys have any questions after, okay? All right, here you go.
Oh, I don't have a fancy PowerPoint presentation. Thank you so much, Sylvia. So what she's talking about is, in law enforcement, we look at things totally different than fire. All right? Pull you over, sir, in a vehicle. I think I've pulled you over 6 times now, but we're not going to tell everybody, okay? So I pull you over and I run your license plate. It's called a 1028 in the state of Texas. I get a return back from the state that says this car belongs to so-and-so. But we also have a local system in our computer. We call it Spillman. I know I don't want to get too technical. It's called Spillman. And it's a local program that we use. We do all of our reporting and everything through. Well, the great thing about Spillman is I started digging into this new program that the city paid a lot of money for, and I said, how can we make it better? And I found out how we can. We can actually take people with special needs, Alzheimer's, dementia, Asperger's, autism, Down syndrome, anybody that has a medically diagnosed by a doctor mental deficiency disorder, whatever you want to call it. There's so many names nowadays. I think the list is long on my paper. But we can take anybody that has a diagnosed illness or disorder, and we can put them into the system. So how many of us are getting older? Yeah, I am too, all right? Little personal story. My grandmother, my mother died when she was young, and I was the only one to take care of my grandmother as she was aging. She started out with dementia, went into full-blown Alzheimer's. And I was her caretaker. I moved her into a cabin right next to my house. I built a cabin for her so I could take care of her. Luckily, she knew I was a cop and she was scared. So she did pretty much what I told her to do, even though some days she didn't know who I was. But the fear was that when she lived in Jacksonville, I got a call from the sheriff's department saying, hey, we found your grandmother walking down Highway 79, 5 miles from her house. And it's just grace of God that I'd put my Greenville Police Department information in her purse and in her wallet and everywhere I could in case something ever happened. Long story short, I went and got guardianship of her, and I took care of her until she passed away. But I look around and I'm like, hey, we're all getting older, and we never know if it's going to hit one of us. That's the scary thing about Alzheimer's dementia. We never know who it's going to affect. It could be me. It could be my wife. It can be my children. Some people get even younger. So how can we set that up? So at the police department, I set up in the Spillman a system so that there's some paperwork, and I'll go over all that here in a second, but you fill out this paperwork, and you have to come to me and meet with me, and we fill out all this paperwork together. You bring your medical diagnosis and all that stuff, and I put it completely into the computer system. I also take brand new pictures of you. So we take a picture of you today. And every 2 years, you have to come redo everything because we change over 2 years. 2 years ago, I was a little bit fatter. A year ago, I was a lot skinnier, and now I'm fatter again. So, we change. Maybe it should be every year on my weight gain and weight loss. But with that being said, we take pictures of you. If you have a vehicle and you still drive, we take a picture of your vehicle. So we put all this into our database, which is actually not really a database, it's our actual Spillman system. It already exists. So when we pull you over, as soon as he runs your license plate, guess what happens? It shows this vehicle is connected to a person in the special needs database. So let's say you have Alzheimer's and you got into your wife's car and you started driving and she had no clue about that. And you got pulled over because you were a reckless driver. Because that's what most Alzheimer's calls come in as, a reckless driver. So you get pulled over. As soon as that officer pulls you over and runs your license plate number, dispatch immediately knows there's something with that car, that there could be a problem. Maybe you're not a reckless driver. Maybe you're confused, disoriented, or something like that. So then they go make contact with you. They get your name. Maybe you don't remember your name. We can laugh. You don't know how many people in my career I've gone up to and I said, "Sir, are you okay?" "Yes." "Well, what's your name?" "I'm fine." "Sir, do you have your wallet on you?" "No." And then we're sitting there on the street trying to figure out who this person is. And we know they've got Alzheimer's. We go through plenty of training. We know what's going on. But it's so hard to identify this person. So that's why we have the pictures in there. So let's say you live off of Stonewall Street. All right, you live over by Bowie School, 6,000 block of Stonewall, that area. And we find you roaming around Buena Vista. We can search that immediate area because we have a mapping system that pops up too. On that map, there's little dots. And it says, hey, on Stonewall Street in the 5900 block, there's a gentleman that lives there who is in our special needs database. Hey, let's click on that person. We click on it. We pull it up. Now we have your picture. We have all your emergency contact information. We have everything for you. And we can get you home safely. Because that's the goal, is to make sure everybody gets home safe. It happens. It happens. No matter how much, my grandmother, it happened at my house. No matter how much I tried to make sure she was safe, she roamed off one day. And that's the worst feeling in the world when you come home and the person you're taking care of is gone. And you don't know where they are. Are they dead? Are they alive? What's going on? And it's scary. I've been there. And that's why this is takes heart to me a lot. Couple of things. I'm taking more time than I'm probably supposed to. But pretty much a lot of questions are asked is it confidential? So the reason we put it on our Spillman server is our Spillman belongs to us. Chinese government is not going to hack your information. All right? It stays in our in-house information. We are the only ones that have access to it because we have your personal information on there. We're going to protect it. All right? It's secured with all the other records that we have on file. Who can sign up for the program? Like I said, anyone that's been diagnosed can come up and fill it out. The reason we need a doctor's note, how many of y'all know about Amber Alert, Silver Alert, Green or Blue Alert, all that? Okay. For it to be a silver alert, a lot of people don't know this. The reason a silver alert does not always go out so quickly is because before we can issue that, we have to have some sort of documentation showing that you have been diagnosed with Alzheimer's or dementia. How many of y'all knew that? Exactly. How many people keep a diagnosis on their coffee table? Not very many, right? So we already have that diagnosis. It's with your file, with all this stuff. And guess what we can do? We can put out a silver alert real quick. Instead of taking 5, 6 hours. Not only that, we've already got your picture, right? So we can have your picture out to all the agencies real quick. One of the questions I was asked one time, can I sign my family members up without their knowledge? That's kind of a quick trick question, all right? Now remember I said I had guardianship of my grandmother. Guardianship meant that she was pretty much just like my child. I managed all of her assets. Anything that I said went. She was almost like my child. If I were to sign her up in my program, I have to bring her to me. But if she said, no, I don't want to be in your program, and I looked as the guardian and said, yes, she is, the guardian wins. Now, power of attorney and stuff like that, that doesn't go. You have to be a guardian. So if they're a minor, you don't have to have their permission. If you're a guardian, you don't have to have the person's permission. But if you're just mad at your husband and just want to go sign him up and say he's losing it, and pick on him, then no. He says no, then we're not going to, all right? So let's see here. There's this one thing that said the doctor has not diagnosed me with Alzheimer's yet, but I'm worried. That's one of those gray areas that we're going to work with. I have friends who are older who are starting to show signs of this that I go to church with and I'm with weekly. And I really hope that they take advantage because I can see them progressively getting worse and worse and worse as the years go by. And I'm hoping they take advantage of this. Good thing is I'm here, so I can have a picture of them, Johnny, on the spot. But if I wasn't here, I'd really hope they take advantage of this. And that's that gray area where I will sign you up because of the fact that if you realize that you're starting to get to the point where you don't remember so much and you're afraid, maybe you've had a spell. Maybe you've had one of those episodes where you don't know where you're at and you got confused. Doctor might say, oh, well, we don't know. Come to me, we'll get you signed up. All that affects is a silver alert later. Can I sign up if I do not live in Greenville? Somebody was asking that earlier. Who lived in Campbell? I saw somebody from Campbell. Okay. All right. Do y'all come to Greenville a lot? You come to Greenville quite often, right? A lot of people come to Greenville, right? You don't have to live in Greenville. All right? You do not have to. Now, here's the thing. Our system does not talk with Hunt County. So if you tell them I'm part of the special needs database at Greenville PD, they have to ask us for that information, okay? Because it is our system. Just like the fire department has their system, Greenville PD has our system. It does not communicate with Hunt County, Commerce, Quinlan, all those, all right? So if you do sign up for this and something happens, maybe you have an autistic grandchild or something like that, and they get signed up for it, we have to be notified by that agency that's investigating it for us to give all that information. All right? And how long will my information be kept? It's kept for 2 years unless you re-sign. I think Sylvia was wonderful, and she handed out all that paper. Y'all have now plenty of stuff to burn if you need to. All that paperwork right there is how you sign up, and every 2 years you have to fill it out again. Why? We move. We get older, we get fatter, we get skinnier, we get grayer. I'm starting to learn that. And the thing is we want your information up to date. Phone numbers change. If you notice and you look through that packet, there's a lot of emergency contact information. And the reason is when we find somebody at 2 o'clock in the morning, been there, done that, we need to get a hold of somebody. All right? And that's why we ask for that. And on the very back, I think it says, how much does it cost? Now, this is the thing that killed me. When we started looking into this 2 years ago, the programs that were out there, they cost money. They literally put a tracking device on you in some of them, which is fine, especially with a small child who's autistic, I understand. But I wanted to find a way to make sure that anybody that signed up for this, I'm not saying it's the greatest thing since sliced bread, but it's pretty good. But I wanted to make sure that it did not cost a thing and that we could have access to all that information immediately. So it's completely free. It's all done in-house. All you have to do is contact me, and I've got my business cards here. Y'all can contact me anytime you want. Like Sylvia, I'm going to stick around and answer any questions. I'm sorry I took a little bit longer than I was supposed to, but does anybody have any quick questions before I turn it over to the next speaker? Yes, ma'am. 2 weeks. I'll get personal on that. I don't say I a lot. I always say Greenville Police Department. It's been friendly how long? Almost 2 years now? It's been almost 2 years I've been trying to get this program in place. I've been fighting for it and fighting for it and fighting for it. I've gone through legal battles. I've gone through everything you can imagine. And I fought and I fought and I fought. And we finally got it all signed off on. If there's any lawyers in the room, y'all have a purpose. Sometimes it's to make our lives miserable, but it's okay. But it got held up in a bunch of other places. And so we got it. Matter of fact, 2 weeks ago, I want to tell you 2 weeks ago, I signed up my first young autistic child. He's the first one to go in the system, little young boy. I'm not going to say his name, but he's wonderful, amazing young boy. And it was so cool for me because it's the first one to go in the system. And it was great. And some of the things, any of y'all that have any family members with special needs, they have light sensitivity, sound sensitivity, such sensitivity. And so I was explaining everything to the mother, and it's like, does your child have any touch sensitivity? And she said, oh, yes, he does. He does not like to be hugged. I was like, okay. Next thing I know, he's doing this. He's going. He gave me the biggest hug and probably about 40 kisses. And I looked at the mom and I said, you sure he's touch sensitive? And she said, I don't know what's wrong with him. He must really like you. And so I got hugs and kisses for probably about 15, 20 minutes while we were doing all the paperwork, but it was amazing. And I'm ready to put more people in there. Like I said, it is a little more consuming than what Sylvia has. You have to come up and meet with me. We have to set up an appointment. We have to take pictures, and we have a lot of information we need. All right? But that's so that we can get you home safe and that your family members are safe. All right? Any more questions? Miss Julie's ready to take it away from me.
Now? Okay. All right. That is awesome information, and congratulations on getting these programs approved. Wow. We need it bad. All right. Our next speaker, glad they made it. Okay, Clarissa, you're going to go next. All right. Clarissa Clarke. I've known Clarissa for a couple years now. Well, actually more than a couple years. She's with the Alzheimer's Association out of Dallas in Northeast Texas. She has been with them since 2012 and is the Director of Public Policy. I think we first hooked up when we went to D.C., right? Yeah, so we went to D.C. She works with the volunteers who advocates the policies and the changes in the state and the federal level. This is a smart lady right here. So I am so glad that you made it. I understand there was a wreck on 2 wrecks on 380.
Our first time back on I-30 since the pandemic, and I didn't miss it, you know.
Oh, gosh. All right. Well, I want to welcome Clarissa Clarke with the Alzheimer's Association.
Thank you, Julie. It's a different PowerPoint, actually, sorry. Because we've got Julie's right there, and you will see, if you can see, Julie's in the picture, and she came to Washington with us. So let me go to the next. Oops, wrong way, sorry. How does this work? Next slide. Oh, there. Okay. Hi. Thanks so much for having me. I just want to go over some of the most recent statistics on Alzheimer's disease, just to get that out of the way. This just came out in March of this year. Currently, 1 in 3 seniors in the United States dies of Alzheimer's. And that's more than breast cancer and prostate cancer combined. There are more than 6 million people in the United States with 11 million caregivers taking care of them, doing unpaid care. During the pandemic, 16% more people died of Alzheimer's than usual. Can you not hear me? Okay. Let's see. Now, in Texas, there are 400,000 individuals with Alzheimer's, and that's people over the age of 65. Texas has the 4th largest Alzheimer's population in the United States, and it ranks as the 2nd most deaths from Alzheimer's. Alzheimer's deaths in Texas during the COVID pandemic increased by 26%. So I'm going to talk about where we started as far as how this all started with these federal programs. Because of the growing population of people with Alzheimer's, it was decided there needed to be a plan. So it started with the National Alzheimer's Project Act, which was signed into law in 2011, only 10 years ago, if you can believe that. It required the Secretary of Health and Human Services to establish an advisory council on Alzheimer's research and services. The council consists of 22 members who are patient advocates, healthcare providers, state health department officials, researchers, and voluntary health organization representatives. They meet 4 times a year to come up with recommendations about ways to improve health outcomes, reduce the financial impact of people with Alzheimer's disease. The most recent meeting was actually last night, so I'm looking forward to hearing what they decided, what they came up with after that. Okay, out of this plan came the National Plan to Address Alzheimer's Disease in 2012. It established 5 goals. That is to optimize care quality and efficiency, expand supports for people with the disease and their families, enhance public awareness and engagement, track progress and improvement, and this is a big one, prevent and effectively treat Alzheimer's disease by 2025. Not very long from now, y'all. So now let's look at some of the progress that has been made in 10 years, which is not bad. Okay, the greatest achievement has been the 6-fold increase in Alzheimer's research funding at the National Institutes of Health, which is huge. This is unheard of for any disease to get this kind of funding, not even HIV/AIDS. So in response to the national plan, the National Institutes of Health had an international conference with Alzheimer's research and scientists. As a result of the conference, they established timelines and goals and milestones to be able to effectively treat or prevent by 2025, which we're coming close to. There have been follow-up conferences every few years where they've, changed things a little bit. But it also plans for coordination of research efforts with international, public, and private entities. The Alzheimer's Association is the 3rd largest funder of Alzheimer's research in the world, behind the governments of China and the United States, or United States and China in that order. So we really try and are trying to do that too. As a matter of fact, our international conference starts next week, and part of it is virtual. There are some things for lay people that's not totally over your head. Last year it was virtual. They had over 6,000 researchers from 300 countries tune into it. So it's being worked on. But as you can see, the funding really started to go up in 2014, and that's because of the Alzheimer's Accountability Act was enacted as part of the appropriations bill. The law requires that scientists submit a proposal from NIH, submit a proposal directly to Congress, because they're the ones that know what they need. So it's known as the Alzheimer's bypass budget. And it specifies it's working on these goals for that 2025 goal. So that's where you see these really large increases. Now, I'm just going to talk about, we support a lot of legislation, but I'm just going to talk about a few things, big things that have happened fairly recently. In addition to research, the national plan addresses the need to support those with the disease and their caregivers. Just my little story, my stepfather was diagnosed with Alzheimer's by the VA in Dallas. They told my mother, this was This was before I worked for the association in the late 90s. They told my mother it was going to ruin her health, ruin her financially, and there's nothing you can do. Here's a prescription. And I didn't know about the association. We didn't know what to do. So I'm sure a lot of you have had something similar or something like that. So it was decided that people needed comprehensive care planning when they're diagnosed. So the Hope for Alzheimer's Act was introduced. This legislation created a Medicare and Medicaid billing code allowing doctors to be reimbursed for comprehensive care planning. And it can be done by their physician's assistant or somebody else to be able to make people aware of what they can do, what their options are, and what they should be doing. It was enacted into law in January of 2017. We know that there are many benefits to caregiving. It allows diagnosed individuals and their caregivers to learn, like you all are learning here, about medical and non-medical treatments, clinical trials, support services available in the community, like Julie's doing. We know also that individuals receiving dementia-specific care planning have fewer hospitalizations, fewer emergency room visits, and better medication management. As you may or may not know, 95% of people with Alzheimer's disease have another chronic condition, such as heart disease or diabetes. So care planning is key to coordinating and managing those conditions. It also ensures, and what the police officer was talking about, that the Alzheimer's or dementia diagnosis is documented in the individual's medical record. That's very important, for every doctor to know that they see that this has been a diagnosis. And this is consistent with the recommendations made in the National Project Act. Another piece of legislation that passed a couple years ago is the RAISE Act, which stands for Recognize, Assist, Include, Support, and Engage. As many of you all know, caring for people with Alzheimer's is time-consuming, difficult, physically and emotionally demanding. So in 2018, we and our volunteers helped pass this act. It requires the Department of Health and Human Services to develop a national strategy to address the needs of caregivers, including education and training, long-term services and supports, and financial security. It's going to be updated annually, and this is caregivers of people with all chronic diseases. It also directs Health and Human Services to create a family caregiving council similar to the Alzheimer's one. The council includes 30 individuals from the public and private sectors, such as caregivers, employers, older adults and persons with disabilities, state and local officials, veterans, and long-term care providers who provide supports and services. It is run by the Administration for Community Living, which is under the Health and Human Services. They meet 3 times a year, and the most recent time was April 28th. The website, and we can get this to you later if you want, is A as in Apple, C as in Care, L as in Larry, or Association for Community Living.gov. It's a really cool website, and there's places that you can put comments on there about your difficulties with caregiving. You can watch the videos of the council meetings, and when the next ones are happening, you can watch it live. Because getting everybody's input is what they're looking for. They're hopefully, in the next year or so, they're going to come out with some big recommendations. Next piece of legislation was the Bold Infrastructure for Alzheimer's Act, which was signed into law in December of 2018. It establishes centers of excellence throughout the country that will increase education of public health departments, healthcare professionals, and the public on brain health and brain disparities. We've learned the importance of public health in the last year, why it's so important for people to be aware of everything that's out there. So this would provide funding to many public health departments. It would also help them to implement effective interventions for Alzheimer's, which include early detection and diagnosis, reducing the risk, preventing avoidable hospitalization, reducing health disparities, supporting the needs of caregivers, and supporting caregiving for people living with the disease. Since its passage, there have been 3 centers of excellence that have been chosen. Each focuses on a specific area. The University of Minnesota is doing dementia caregiving. New York University School of Medicine is doing early detection of dementia, and the Alzheimer's Association is doing dementia risk reduction. The legislation also included funding at $20 million a year for 5 years. Okay, another piece of legislation which passed last year, it was very important, is the younger onset for Alzheimer's disease. There are only about 200,000 people with younger onset Alzheimer's. That's people under the age of 60. But they face some really unique challenges when it comes to many, have families, young children, they're still working, so their finances and their families that people maybe over 60 don't have. They're not have Medicare, but that kind of thing. So there are not support services for these people. And there's really not a lot of other things out there. So this legislation allowed individuals with younger onset to access supports and services under the Older Americans Act. As many of you may know, the Older Americans Act was passed in 1965, and it focuses on delivering home and community-based programs like nutritional services, in-home services, transportation, legal services, and caregiver support. So we've successfully advocated for the Younger Onset Alzheimer's Disease Act to be reauthorized in the Older Americans Act last year. Okay, so that was what we've done in the last few years. So what are we doing this year? Talked a little bit about this before. So this is our request for appropriations. We're asking Congress for an additional $289 million for Alzheimer's research at the National Institutes of Health. That's what the scientists said was needed to get this 2025 goal. Also to fund the BOLD Act at $20 million. Now, when I'm done, I'm going to pass around, I have a sign-on letter to your Congressman Pat Fallon, asking him to support this, to support the research and the BOLD Act. Put your name, address, and email, and I'm going to give it to Congressman Fallon's office so he knows that this is important to you, because they need to hear from us. Okay, the Caregiver Support Act is another piece of legislation. It's been around for a little while. It's been reintroduced. So, of all the caregivers talked about with chronic disease or diseases, nearly half of these caregivers do so for someone with Alzheimer's disease. So, more than half of dementia caregivers also have a chronic condition themselves, making it extra difficult. And caregivers spend about 20% more time than they did 10 years ago. So, there are 1/4 of people who are in that sandwich generation. So they're caring for someone, a parent who maybe has Alzheimer's disease, and they have children in school. So there are many caregivers that have had to quit their jobs, reduce their work hours, or take time off because of caregiver responsibilities. Sadly, my mother also got Alzheimer's, and she passed away last year, but I was fortunate to work for the association who really understood, and I could, because she'd call me, something was horribly wrong, and I could just leave work, but not everybody can do that, and you know how difficult it is. So, this legislation would help them to be able to understand, to get grants for public and nonprofit organizations to provide training and support services for families and unpaid caregivers. It would also provide services to improve caregiver health and allow those living with the disease to stay home in their homes longer. Eligible grant recipients would include healthcare organizations, community health centers, senior centers, area agencies on aging, local and state and local public health departments. The bill would ensure that grantees provide public outreach on all the services that they offer. And it would require that at least 10% of those funds to the applicants that primary service serve medically underserved communities. So we've been asking for that. Another piece of legislation that was just introduced this year is the Comprehensive Care for Alzheimer's Act. So what this would do is ask the Centers for Medicare and Medicaid Innovation to test a better payment structure for dementia care management. Now, it's kind of a complicated issue, so I'm boiling it back down to the basics because I honestly don't get it all. But so dementia care management would ease the challenges of caregiving by improved quality of care and reducing the costs. It's a model that's been proven to reduce healthcare use and costs to improve the quality of life for individuals with dementia and their families. It's been used in cancer treatment for people with cancer, hip replacement. It would be one doctor's office coordinates everything. So instead of paying a fee for each service, providers would receive an annual per patient payment for all the services provided under the program, including important services that are not otherwise reimbursed under Medicare. And this structure would allow dementia care management programs to be financially feasible for healthcare providers and practices, especially for smaller practices and in rural areas and inner-city community health centers. It would provide services such as the development of a dementia care plan, care coordination and navigation, caregiver support, education and support. This theme is a recurring theme in all this legislation. If we get it, the more we put out there, the more hopefully it'll get passed. It would ensure that the patients have an interdisciplinary team of providers with dementia care expertise. So again, if they have another chronic condition, one doctor's office will work with these other providers. And it would reimburse the providers a set amount per enrolled patient and an incentive payment based on their performance. Another piece of legislation that was just introduced this year is the Equity in Neuroscience and Clinical Trials Act, and it would increase the participation of underrepresented populations in Alzheimer's and other dementia clinical trials. Alzheimer's disproportionately affects Black and Hispanic Americans compared to older whites. Blacks are 2 to 3 times more likely to develop Alzheimer's. Hispanics are 1 to 2 times. Despite being more likely to have the disease, decades of Alzheimer's research has not included sufficient numbers of Blacks or Hispanics to be represented in the research. So there's an urgent need for current and future research to include increased numbers of underrepresented populations, so that everybody can benefit from the advances. So this act would expand access and increase outreach to underserved communities, enhance diversity of the clinical staff, and reduce participation burden. This is our federal legislation that we've been working on. So, let me go back. Last year, in this legislative session, this year that just ended in May, which, crazy. We had some great successes. As you may know, Alzheimer's is the most expensive disease in America, costing more than heart disease or cancer. And it's escalating epidemic, it's having an effect on budgets. So the more we can do about it, we can reduce these costs. During the legislative session in 2019, we successfully secured $1 million in the state's general budget for the Department of Health Services Alzheimer's disease program over a 2-year period. Prior to this period, they were getting $160,000 or $80,000 a year. So this has helped move the needle with things in Texas. This year, due to the pandemic, we were facing budget cuts. They told us State Department of Health Services was going to cut that $1 million. They assured us the program wouldn't go away. However, they were not including that in their budget. So that got us all riled up. Thankfully, from our advocates, we were able to secure that $1 million in the budget. If you look at this graph, I don't know if y'all can see this very well, that should be 400,000 for Texas. If you look at, say, New York has 410,000 people with Alzheimer's disease, 10,000 more than us. They get $25 million for their Alzheimer's disease program. Ours is $500,000 a year. Georgia has 140,000 people with Alzheimer's disease. They get $4.12 million. So we have a long way to go, but at least we got that $500,000 again. I mean, yeah. Okay. Something else that we passed was this long-term care transparency. I don't know if any of you have looked at like nursing care home facilities, but a lot of them market themselves as memory care facilities or something similar, which can be misleading to residents and their family members. Prior to this legislation, the facilities do not have to overtly disclose whether they are or are not state certified as an Alzheimer's facility. So they can just say they have a memory care or whatever, but people don't know. I mean, who knows how to check? So we worked with the legislators to ensure that families are fully informed on the level of care that the facilities advertise, market, and promote themselves as providing care or treatment to people with Alzheimer's in either a special unit or under a special program. So that passed this year. Another thing, and our law enforcement officers are gone, but we were able to pass a Dementia Care Training Act for law enforcement. You know, as he talked about, they frequently interact with the individuals with Alzheimer's in a variety of settings, and you know, there are special needs on that. And actually 70% of people with Alzheimer's dementia actually live in the community rather than in a care facility. So especially law enforcement will interact with them quite a bit, whether it be looking for a lost individual, stopping drivers who exhibit unsafe driving, rescuing people from abuse, or intervening in a crisis or disaster. And, you know, as you know, their behaviors, they may seem uncooperative, disruptive, combative, difficulty communicating and understanding. So it's important that the law enforcement have adequate training on how to recognize this and how to deal with people to avoid less confusion. So many of the law enforcement units across the state have been working closely with our individual chapters to enhance their training techniques and protocols. And we have worked with the Texas, it's called TCOL, I can't remember what it stands for, but it's the Texas Law Enforcement, to provide some more training for law enforcement requiring it across the state, because we've been doing it here and there. So, okay, so what can you do? First of all, because we couldn't do any of this, I can't go to every congressional office, and they don't want to see me. They want to hear from their constituents, as Julie knows. So we couldn't do it without our many volunteer advocates, and it's really easy to do. If you want to do the first thing, if you want to know when there's a piece of legislation, like one of these pieces of legislation we talked about, like we just had one sent out for Alzheimer's research funding, you get a text, and it says, tell your congressman and your 2 senators that you want this Alzheimer's research to be passed. And you just put in your name and address, and you hit send, and it goes directly to them. You don't have to send it all. So if you want to get on your phone, and when you put in the number, like you're going to put in the phone number, you do 52886, it's a weird number, and then you write AIM in the message, and it will automatically generate you to sign up to receive these text alerts. So they hear from us. They need to hear from us. We also, we recruit and train volunteers. We do things like meet with elected officials a few times a year, raise awareness through local media with letters to the editor, and we provide templates, and then you can personalize them. If you're in, I'm not much into social media, but if you're into that, you know, they look at their social media, coordinating events like town hall meetings. I'm actually planning one with Representative Fallon. Now, you know, y'all's district is really big, but I think we're going to try it in Sherman at a long-term care facility to try and get him to do some Q&A kind of thing. So hopefully he's going to want to do it. So I will also pass around a form if you're interested in signing up, and once I get that, you'll get it like an email, and you can choose what you want to participate in. If you don't want to have meetings, if you just want to do like letters to the editor, whatever you want to do, it's, you know, it's probably an hour a month, if that. So, but it has a huge effect, believe me. We had our, let me go to the next one. We have an annual advocacy forum every year. You can see Julie's picture again. She went to DC one year. This year we had to do it. It was canceled last year because it's usually in the spring. It's usually late March, early April. Well, you know what last year was. So it got canceled at the last minute, and they didn't really. This year it was virtual again, but we had 3, like Congressman Gomer. We didn't have Congressman Fallon, but they came on Zoom calls, and we asked them for all these priorities. We said, this is important, and they love to hear from their constituents and why, and hear your story. That's the important thing, hearing your story, not me just blabbing on about the statistics. So every year, and we are going next year, there's like over 1,000 advocates from all over the country. We have a big group from Texas that goes to this meeting. You learn about all the legislation, and then on the last day, everybody wears their purple sashes that you see and goes on Capitol Hill, and we are everywhere. People know we are there. So if that's something you're interested in, you'll get some of the, you get some information on that too. And then besides our advocates, we couldn't have done all these great increases without the Alzheimer's Impact Movement. What that is, it's a sister organization to the Alzheimer's Association. It can do things, it's a 501c5, and it can do things that the Alzheimer's Association can't do, such as like lobbying. It's a nonpartisan, nonprofit advocacy organization working in strategic partnership with the association to make Alzheimer's a national priority. So, and if you're interested in that, I can get you some information on that. And now I just had, if there were any questions? Yes.
Did you say 1 out of 3?
1 out of 3.
People get Alzheimer's?
1 in 3 die. 1 in 3 seniors die from Alzheimer's in the United States, which is more than breast cancer and prostate cancer together. So, a lot. Yeah, and Texas has the second most deaths from Alzheimer's of any state in the country. So we need to get more than $500,000 a year for our disease program. Yeah.
Is it still 65 seconds, 66 seconds?
Yeah. Yeah. Unfortunately, yeah. And, they're working on a lot of new drugs and a lot of new science. They're trying to get to that 2025 goal, but, it's just a complicated issue, but kind of all the research on your brain, but hopefully we're going to get somewhere really soon. But we also, want to help caregivers. So you heard that theme going through on all these bills. So the more we throw out there, maybe it'll pass.
Are the 20 statistics for United States and Texas, are they available through Alzheimer's?
Yes, on the Alzheimer's website, yeah. Yeah, yeah. So, okay, thank you.
Thank you very much. Now, she is going to pass around the sign-in sheet that we're going to send to Representative Fallon, and we're going to take a 5-minute break so we can get this signed. We have cookies, and make sure you get grapes. If you take a cookie, you have to have some grapes. There's water, and your restrooms are right back there in the corner. So we'll come back in about 5 minutes. All right, if we'll go ahead and take our seats, we will finish up with our final speaker. We have Victoria Jones. She is also with the Alzheimer's Association out of Dallas Northeast chapter. She is a community educator, and she does a lot of presentations about the disease itself and learning about communication strategies. She also facilitates support groups, special caregiver programs, such as stress-busting programs for caregivers. If you all are interested in this, you need to go to the Alzheimer's website and find out about this program. It is, when I started with the association in 2016 and really in depth in 2019, I found about this program, and it is phenomenal. Very, very helpful to the caregivers and the changing gears as well. So Victoria has a lot to present tonight. And like I said, I want to thank both of you all for making the trip out here from Dallas and getting stuck in some beautiful traffic in I-30. So I'm going to turn it over to Victoria. Thank you.
Can you hear me? Good. Okay. Do I understand that all of you are caregivers? How many of you are caregivers? Everybody's a caregiver. Okay. So this is about those hard conversations. Are you all still dealing with issues about driving? Is your loved one still driving? Okay. So we might go past that some. Doctor visits, hard to get them to the doctor. Okay. Legal and financial planning. Is all that in place? Sure? Okay, good. Well, these are hard conversations to have sometimes. The discussions may not be easy, and so often we want to put it off to the right time, whatever the right time is. So as caregivers, that you've noticed that your loved one, back. You've noticed changes in the person, and I'm assuming that when you noticed those changes, were you writing down some of those changes so that when you went to the doctor, you could talk to the doctor about what was going on with your loved one? I want to make certain that this is targeted to what your needs are. So going to the doctor is terribly important. Also, deciding when to stop driving. Sounds like that's not an issue for you. And then making those legal and financial decisions and covering all of that stuff, because that's important so that the sooner that you get a diagnosis for your loved one, the sooner you can start the plan. And the sooner that you can get the right care for your loved one, and your loved one still has the ability to make decisions about his or her care in the long term. And you also have a chance to put your care team together, which is terribly important also. So, today's program is going to provide tips on how to break the ice with those common and very difficult conversations, help you plan ahead and build your care team, because you can't do it alone, can you? I bet each one of you can do anything, but you can't do everything. So making certain that you ask for help, and for some of us that is hard to do. So it helps you to plan ahead and build that team that also has good communication. It also gives you the opportunity to hear from people who are dealing with similar situations. If you reach out to those who are in support groups, say, who are maybe a little farther down the road than you, to share that communication with your care team and a support group. And it also helps you connect with resources as well. It's a little slow, good. So you hear all of these conversations. My sister lives close by. Oh, she can help. Oh, I'm fine. Don't worry about me. I'm sure you heard all of that from your loved ones. We just started to notice some changes in Mom or in Fred, and we'll just wait till the right time because I don't want to hurt his feelings. So we put off some of those hard conversations. Have you done that already? It was hard to bring that up to your loved one, to say, I've noticed some changes in you. And so we have to have a conversation. We have to maybe go see the doctor. So here's what we start with. The sooner the better. Developing a plan is very important. So do not wait for a crisis. Don't wait for the other shoe to drop. You need to get right along with it. And next, you develop a plan that we call to have finesse in the conversation. So we want to make certain that it goes well, so we maybe practice. We maybe choose the right words so that our loved one isn't offended, that our loved one sees that we really are on their side and we're here to help. We want to be with them through the thick and the thin of life. Taking notes, very important. So as you observe the behavior in your loved ones, you're writing down what you observe and dates, because this will help your physician and your other team members know what's going on with your loved one. It also gives you proof when you do have that hard conversation with your loved one that you can say, on January 5th, I noticed that you put the keys in the microwave. And they really don't go in the microwave. Or you can document that so you've got some evidence to back up what that hard conversation can be. But you're doing it sensitively. Taking notes and observe changes that you see, and then practice in advance, because you want to make certain that your loved one is going to receive that information, well, without hurt, we hope. And so now we're going to talk when you are both relaxed and comfortable. So you pick the right place to have that conversation so that you don't hurt the person. And you might have to do it 2 or 3 times. There we go. So often at this time, when someone in your life is showing these changes of forgetfulness, then they have a lot of fear sometimes around going to the doctor. They maybe are angry. They know something's going on in here, and they don't want to admit it, so they can get frustrated or angry because they can't remember the things they used to, or they can't do the things that they used to do. So you'll see some issues that go beyond kind of typical aging, with some forgetfulness and some anger and angst that goes along with that, perhaps. And sometimes the person is just reluctant and doesn't want to go to the doctor because I've never been sick before, I'm not going to go back. But we have to do our best to coax them into seeing that it's with a doctor's diagnosis that we can move forward. Oh, we don't have, this isn't. Oh, I did that. Oh, wait a minute. Sorry, I got too many things going on here. Can I activate her? We have videos embedded into our presentation. They're not working. Okay. Well, that's okay. She was good. Well, okay, we will go past those then. Okay. So, going to the doctor. We want to use words that are most comfortable for your loved one. We want to make certain that they're comfortable going to the doctor. Let's talk to the doctor about the fact that you haven't been remembering very well, so you have a purpose for going to the visit with the doctor. The next thing we're going to look at is suggest some Medicare, maybe a free annual, your annual wellness check. So if your loved one is reluctant to go to the doctor, then we might have to make up a story to say we've got to go to the doctor because we have to get that wellness check, or maybe we need a prescription refilled. So we might pair that outing with something that would be fun. Going to the doctor, we might pair with going out to lunch. Or, gosh, the doctor's office is over by Aunt Florine, so let's go see Aunt Florine after we go to the doctor. So you're making it, cajoling your loved one into getting to the doctor as easily as possible. And we want to include family in the communication and share what's going on with your loved one, with family, and perhaps close friends. Sometimes people do not want to share this. There we go. Do not want to share the information outside the family. It's something of a stigma. But you got to put that away because you need all the friends you can get. You need people who can help you with advice, with support, who can know what your situation is, because you can't do this alone. You can't do this alone, and you don't have to. There's a lot of support out there for you. So getting in family involved with some of the hard conversations and helping to practice how you're going to approach your loved one. And then we can always rely upon the therapeutic fib. We have to do this. Haven't you all used the therapeutic fib in life, and particularly with your loved ones sometimes? Because you just need to make certain that they see that we've got to go to the doctor, got to renew that prescription, annual checkup. You've seen this doctor every year for the last 18 years. Why should this year be any different? So all of that is important to cajole your loved one into seeing the physician. Now, I think we may skip past the driving part since that's not an issue for us, is it? No, okay. And he's not going to talk to us anyway. Yeah. Have you, if you don't drive anymore, have you found other ways for transportation for your loved one? Have you looked at for example, right here, what's on the screen is you have public transportation here. Do you have people who have maybe volunteers who take people to doctors' offices or take people around? Have you gotten into that? Okay, that's a great way. So your loved one doesn't feel stuck and trapped. That's very important too, yeah. And then incorporate, perhaps you need a professional people to stop driving. So that's all about driving, yes. Good, okay. Yeah, sorry we're not hearing these videos. They're quite nice. Okay. Okay. Yeah, this is a big part of the program. The legal and financial piece is very important, and sometimes this is hard for us to talk about money. It's very important that the early diagnosis will allow your loved one to take participation in how things will go as things progress. We know that with early diagnosis, before the person has lost too much memory, they can still make their wishes known of how they want their assets to be distributed, what's going to happen there. They want to have a say in things. And if you wait too long, then that person has a diagnosis that will not permit them to be able to make those financial decisions. And so you have to step in. So earlier the better. Sometimes people are reluctant to have these conversations. It's uncomfortable. They feel it's intrusive. But it's terribly important to make certain that the financial pieces are together. The Alzheimer's Association website has an excellent list of the directives, durable powers of attorney, durable power of attorney for finance, for health care, the directives for when you're incapacitated. All of those are very important to go through. So I would recommend, so you begin by explaining that you are in this together, that you are not, oh, I'm doing the wrong one. Let me go back. That you are not there to be invasive, but that you're there to help with some of the planning, that you're there to carry out their wishes. And then you want to start by asking questions and gathering the documents. I've been doing my will and all the directives, and there's a lot of paperwork, and it's very confusing. So much of it you can do by yourself. You don't need a lawyer for some of the directives. You need them notarized and witnessed, and so You get your lawyer involved when you're dealing with wills and trusts, but for some of these things you can do yourself. But that's all explained nicely in the website. So explain that these are standard plans that need to be done for every older person. So if they don't have a will, or maybe the will needs to be revised because their conditions have changed, then that's a normal thing that people would have to do. We all need to be reviewing these documents once a year, or maybe when things change. And a diagnosis of dementia certainly means that things have changed some. So explain that it's just part of being an older person and making certain that assets are being distributed where they want it. So it could be that you break up the conversation in different parts, because this can be very overwhelming. And sometimes it's difficult to find the right location and the right mood, but you might need to take this in sections. And this is where you also might get family involved to help with smoothing over these times, finding the right time to have the conversation. And that's in involving other people as you need to make certain that it goes smoothly, to make certain that the wishes are carried out. And plus, you as caregivers have so much to deal with. Having those financial papers in place, secure, and feeling that some level of confidence there gives a lot of peace of mind. Now, the care team. This is so important. It's very important to build your care team. For every person who has dementia, there are at least 3 caregivers who are disrupting their lives to care for that one person. And then the lives of the families of those 3 caregivers are affected as well. So it has a ripple effect through families in caring for a loved one. So the care team, get the word out to the family. This can be difficult because not everybody agrees. Oh, there's nothing wrong with Mom. Oh, Francine is just fine. She's just a little forgetful. She's getting old. Alzheimer's is not a normal part of aging. Alzheimer's is not a normal part of aging. So enlist family and friends. Get the kind of support you need because you can't do this alone. And then the medical team. It's very important to have doctors you enjoy and like and connect with. I facilitate a couple of support groups, and when it comes up, very often it'll come up that somebody is not happy with the physician. Well, go find another physician. You got to remember, you're the customer, and you've got to have good communication with that doctor, and particularly that say, I need a little more information. I need you to talk where I can understand things. I need you to write things down. Have a conversation with the care team, with the medical team, so that you're creating a good bond there. Peers, neighbors, church friends. Sometimes you're going to need a break. Sometimes you're really going to need somebody to deliver dinner. So the more specific you are with your request and your need, then the more likely you are to have that need fulfilled. So be specific when you are reaching out for your care team and what you need. For some folks who are still working, they have some workplace support for mental health, for physical health, or for days off for those who are caring for a loved one and they're still working. So be sure to share with your workplace what's going on with your life as you are a caregiver. Community resources. Oh goodness, there's lots of community resources available to us. You are not alone in this journey. There's lots of people who want to help you, lots of resources, and we've talked a little bit about that, and I know you've got lots of those to share. So this is a time when you can't be brave, you can't do it all by yourself. You've got to reach out for help or you will go nuts. So, resources. ALZ.org, excellent website. Couple of things for caregivers, the Alzheimer's Navigator, as you see right there. Oops, right there. Whoops, going the wrong way. There we go. Alzheimer's Navigator is a program that you can go on to the website and plug in information about your particular loved one or your situation or your circumstances or your challenge. And after you answer a few questions, it will give you a personalized plan of action with real things you can use. Community Resource Finder, find out what's available in your neighborhood. This is also all on alz.org. ALZ Connected has over 50,000 caregivers who are sharing information, who you can share information. You can even do it without logging on and joining the group to see what people are saying. If you want to post something, then you have to develop a password and all that stuff. Great resource. Alzheimer's and Dementia Caregiver Centers, as was mentioned earlier. Safety Center, keeping your loved ones safe, lots of information for if your loved one wanders, you can get some tags or something to put, identification tags, how to keep your loved ones safe in the home. The 24/7 helpline is fabulous. This is, once again, 24/7 licensed professionals are on the other end talking to you and answering your questions. The folks in my support group who use this are so happy with this because they may call 5 times because different things happen. And each time, the person on the other end goes to the notes on that individual, and the story is all there. So if you call the 5th or 6th or 7th time because you've got a problem, your story is right there. So they're able to read that pretty quickly, and you are able to get some very helpful tips, lots of support. It's a really helpful thing, particularly if you're dealing with a crisis in the middle of the night or in off hours. Support is there. Get involved with support groups. Educational programs like this one are available on the website, so you could review this if there's some information you would like to glean from this. Free education and for getting involved, as Clarissa mentioned earlier as well. Getting involved. We have the walk. We have a walk in this area. What date?
Actually in Dallas.
The Dallas one, November 4th? 2nd? In Dallas, great. Volunteer. I'm a volunteer. I've been volunteering for about 4 years. I worked with a large retirement community before then and worked with dementia folks, so it's a real honor to be able to volunteer and share what I know and have learned. We advocate, as Clarissa talked about, trial match. This is a pretty keen thing. The research is still out there working on finding a cure. They need those of us who don't have dementia and those who do have dementia to sign up for trial match, in which you can put your information in. They'll ask you questions about lifestyle, eating, nutrition, activities. And so the more people they have in the database, the more they are getting closer, they can get closer to finding out what causes this disease. So trial match is a wonderful thing to participate in, and I've got some cards for that as well. So I think that takes us. No one can provide all of this support alone. So we have to talk about it, we have to share it, we have to get it out of the closet and in front of folks. So how about some questions? Did we touch on some of these things that are relevant to you?
I just think that everything that the Alzheimer's offers on their website again is phenomenal. And then 24/7 online. I've got some of the cards over there on the table you can take home with you that has the phone number on it. Take advantage of this stuff. I mean, it's free.
And it's free. Well, and it's not just issues that pertain to your loved one. Maybe you're having a crisis. Maybe you're just at your wit's end and need to talk to somebody. They are there for you. This is there for you. You caregivers have a huge burden, and you can't do this alone. So they understand that you have to have somebody to talk to, and that maybe they can help you find ways to relieve some stress, to help you focus on caregiving for yourself and taking care of yourself. Just like the great example of being on the airplane, you got to take care of yourself first before you can take care of the children or the other people around you. You have to take care of yourself, and that's what's so very critical. So don't forget yourself. You need to go to the doctor also. Make certain that you're keeping those appointments and taking care of yourself. Any other questions? Thank you very much. Pleasure.
Thank you, thank you. All right, thank you ladies for coming, and I think my caregiver support group ladies are going to come up now. Melva Hill is the facilitator along with Shannon Ruth for our Greenville location, and Sue Haney also is here from our Quinlan support group, and they just want to take a couple minutes and remind you guys of the support group. Since this is our last seminar, please reach out to the Alzheimer's Association. I know that all of my facilitators, including myself, are available as well, but there may be times a day where you want to talk to somebody you really don't know, and you have a question you think is really weird and stupid or uncomfortable. You can call them, and they don't know who you are. So please take advantage of them. And Melba?
Thank you, Julie. And thank you for each of you coming out this night and the other nights. I know I've seen a lot of familiar faces that have come back for more than just one. Our group meets on the second Thursday of each month at 6 p.m. at the Script Building, and that's the Senior Citizen Center on Lee Street, 4912 Lee Street. We have ours is set up as each quarter, we do 3 different things. We have just a regular information night where we talk about what's going on in your life. We also have a fun night. We might do a game or any number of things. As a matter of fact, in August, we're going to be doing line dancing. So we encourage you to come and get involved with that. Well, I know we're going to have a good time because our lead dancer, she's been doing this quite a while and really enjoys what she does. We will, then the third time, we have someone to come in and give you some information that will help you. We have had different folks. As a matter of fact, we're going to get those firefighters and police department folks back again to give another little presentation. We have had someone that will be back with us in September. Yes, September. And that's Melinda Porch from Colonial Lodge. And she's going to give us a little overview. And if you were here the other night when she was here, or Saturday, I think it was, you know, she has a lot vested in this type of work. So we try to get people that know what they're talking about and can be beneficial to you. So it's just a group discussion, a fun night, and then something that will give you some tools to move on down the road with your journey. Also, some of the other events that we have coming up in November, the first Friday in November, we do a Go Purple event, and that is to kick off National Alzheimer's Awareness Month. We go to the courthouse, and we have a big program, and lots of folks come in, and we have testimonials and different things from different caregivers. That will be the first Friday in November. In December, we have a Christmas party. And even though we have 2 separate groups, that is one time of the year that we come together, and both of the groups are there to have that Christmas party. And we have a blast. It's a catered lunch, and we do games again, and just make it a fun time. And we ask you to bring your loved one as well, so that they can be involved in it. Our respite care, I know that Julie has mentioned this, but that is so very, very, very important. Take advantage of these respite care services. That's why we enlisted these partners, so that we can make it easier for you. And as our former speaker just mentioned, it is free. Free, free. And we want you to take advantage of it, because if we didn't need it, we wouldn't even bother having it. But because there is a strong need for it, then we are trying to offer as much to you as we possibly can. This journey is not easy to be walked, whether you have a fleet of people or alone. But at least when you have other people that are helping you get through it, then it's a lot easier to walk the walk. So please give us a call. We have plenty of information over there. One other thing I do want to mention, as we have talked about with the stigma of Alzheimer's and dementia, people are reluctant to reach out, and some folks don't want to come to an open group. For those of you who don't know, I am also a pastor. I will be happy to come to your women's group, your Sunday school class, maybe not on Sunday, but your class anyway, but different groups that you might have, and do more of a personal presentation to you, because it is ridiculous that we have so many people going through this alone. We need to get more people involved. We need to get more people in different settings, such as the African American community, the Hispanic community. Wherever we can get out there, that's where we need to be. So if you will call me, I'll be happy to come, and we can start setting up a line, opening up a line of communication, so that it will lead to that family that we have already and increase it in Remember For Me. So we thank you for being here tonight, and here's Miss Sue.
Thank you. On January 9th of this year, my sister Jean passed away, and she had Alzheimer's. The Remember For Me organization kept me together during that period of time that I was a caregiver for my sister. When COVID-19 relaxed enough that we could start our meetings again in Quinlan, our facilitator had been ill all year, and she was not capable of coming. So I stepped up and told Julie, I want to do this because I have to pay back. I have to pay forward what has been done for me and my family through this organization. We have a small group. We don't do all the activities that they do here in Greenville. We meet the second Monday of each month. We meet at the First United Methodist Church in Quinlan, which is on 276, or sometimes they call it Quinlan Parkway. It goes from 10 to 11. We try to keep that time pretty strict, because we know that they have taken time out to come and to share with us. We just try to support one another. We talk, we look for things that can help one another. We share our experiences. We say, okay, I've done this. Let me tell you what I did during that period of time. And it helps us to hold ourselves together. Everybody, as we've heard all night, everybody needs a group. Everybody needs help. You cannot do it alone. No one can do this alone. You just cannot. You have to have people you can talk to. Everybody that comes to our group has my phone number. They are told to call me day or night, anytime. I will answer my phone. I will talk. I will listen. I will help you, whatever you need done. So I hope that if you know of someone in the Quinlan area who is dealing with this situation and they're on their own, that you will let them know that we're meeting, and we would be glad to have them come and be a part of our group. Thank you.
Thank you. Yes, that was quite a journey that we all went on with your sister and June, and I was glad that Remember For Me was part of that. Does anyone have any questions? It's sad to say goodbye. This is our last seminar for the year, but thank you all for coming. Don't forget line dancing at the Greenville support group next month, which is the second Thursday. Everybody's going to go, right? Your hip will be done, so you will be able to line dance. I know that. So thank you, everybody. Thank you, Friendly, for being here. My co-founder friend, Shannon Ruth, our caregiver facilitator in Greenville as well. So thank you all very much.